Institutional distrust in the age of AI, evidence-based organizational responses to eroding public confidence.
Abstract.
Institutional trust in democratic societies has declined substantially over recent decades, with public confidence in government, media, healthcare, and corporate institutions reaching historically low levels. The integration of artificial intelligence systems into institutional operations introduces new dimensions to this trust deficit, as opacity in algorithmic decision-making compounds existing concerns about institutional accountability and responsiveness. This article examines the organizational and individual consequences of institutional distrust, with particular attention to how AI deployment may accelerate or mitigate these dynamics. Drawing on institutional theory, research on organizational justice, and merging scholarship on algorithmic governance, we identify evidence-based organizational responses that can rebuild trust in an AI-augmented institutional landscape. Key interventions include transparent communication about AI systems, procedural justice in algorithmic decision-making, capability building for institutional actors, and careful attention to the psychological contracts between institutions and their stakeholders.
Introduction. Public trust in major institutions, government agencies, healthcare systems, media organizations, financial institutions, and corporations has experienced sustained erosion across democratic societies. In the United States, confidence in institutions measured by Gallup polls has declined from levels above 40% in the 1970s to record lows in recent years, with only small business and the military retaining majority confidence among Americans. Similar patterns appear across Europe, with the Edelman Trust Barometer documenting widespread skepticism toward both governmental and corporate institutions. This trust deficit carries significant practical consequences. When citizens doubt the legitimacy of governmental institutions, compliance with public health measures declines, tax evasion increases, and civic participation diminishes. When patients distrust healthcare institutions, they delay seeking care, adhere poorly to treatment recommendations, and experience worse health outcomes. When consumers lose confidence in corporate institutions, markets become less efficient, transaction costs rise, and economic growth slows. The integration of artificial intelligence systems into institutional operations introduces new complexities to this already fragile trust landscape. As Hartzog and Silby, 2024, observe, institutions increasingly deploy AI systems that make consequential decisions about resource allocation, risk assessment, benefit eligibility, and service delivery, often with limited transparency about how these systems operate or how they can be challenged. The opacity inherent in many AI systems can compound existing trust deficits, as stakeholders struggle to understand how institutions arrive at decisions that affect their lives. Yet the relationship between AI and institutional trust is not deterministic. How institutions design, deploy, and govern AI systems, and how they communicate about these choices, can either accelerate trust erosion or create opportunities for trust rebuilding. Organizations that treat AI implementation as merely a technical challenge often exacerbate distrust. Those that recognize AI deployment as fundamentally an institutional and relational challenge create possibilities for strengthening institutional legitimacy. This article examines evidence-based organizational responses to institutional distrust in the age of AI. We draw on institutional theory, organizational justice research, and emerging scholarship on algorithmic governance to identify interventions that can rebuild trust while maintaining the operational benefits that AI systems may provide. The institutional trust landscape. Defining institutional trust in contemporary society. Trust, in its most basic formulation, represents a willingness to be vulnerable to another party based on expectations of their competence, benevolence, and integrity. Institutional trust extends this concept beyond interpersonal relationships to organizations and systems that structure social, economic, and political life. North, 1990, defined institutions as the rules of the game in a society, encompassing both formal constraints, laws, regulations, organizational structures, and informal constraints, norms, conventions, codes of conduct that shape human interaction. Institutional trust, then, reflects confidence that these rules will be applied fairly, consistently, and in ways that serve legitimate collective purposes rather than merely advancing the interests of institutional elites. Institutional theorists distinguish between several dimensions of trust that matter for how organizations function. Competence trust reflects confidence that institutions possess the technical capacity to perform their stated functions, that hospitals can provide effective medical care, that regulatory agencies can assess risks accurately, that courts can adjudicate disputes fairly. Integrity trust reflects confidence that institutions will adhere to shared moral principles and will not exploit their power for illegitimate purposes. Benevolence trust reflects confidence that institutions genuinely care about stakeholder welfare rather than treating people as mere instruments for institutional goals. The deployment of AI systems touches each of these trust dimensions in distinct ways. Questions about algorithmic accuracy and reliability map onto competence trust. Concerns about algorithmic bias and discriminatory outcomes relate to integrity trust. Worries that AI systems treat people as data points rather than human beings with dignity and agency connect to benevolence trust. Prevalence and drivers of institutional distrust. The erosion of institutional trust represents one of the most significant social transformations of recent decades. Putnam, 2000, documented declining social capital and civic engagement across American society, identifying trust deficits as both cause and consequence of reduced participation in collective institutions. While Putnam focused primarily on voluntary associations and community organizations, subsequent research has extended similar findings to formal governmental, economic, and professional institutions. Multiple factors contribute to this trust erosion. Institutional scandals and failures, from financial crisis mismanagement to data breaches to healthcare quality failures, provide concrete evidence that institutions sometimes act incompetently or unethically. Media coverage amplifies these failures, with negative information about institutions spreading more rapidly than positive information in contemporary information ecosystems. Institutional opacity compounds these challenges. When stakeholders cannot observe or understand how institutions make decisions, they struggle to assess whether those decisions reflect competence, integrity, and benevolence, or instead reflect bias, incompetence, or self-interest. This opacity problem becomes particularly acute with algorithmic decision-making systems that may lack meaningful transparency even for institutional insiders. Economic inequality and institutional unresponsiveness create additional trust challenges. When institutions appear to serve elite interests while imposing costs on less powerful groups, perceived fairness declines. Research on organizational justice demonstrates that procedural fairness, whether decision-making processes are transparent, consistent, and provide voice to affected parties, matters as much as distributive fairness for maintaining trust. Institutions that concentrate benefits among privileged groups while using opaque processes to allocate burdens to disadvantaged groups face predictable trust deficits. The introduction of AI systems can exacerbate these dynamics in several ways. Algorithmic systems often operate as black boxes that resist explanation even when institutions genuinely want to provide transparency. AI systems trained on historical data may perpetuate or amplify existing biases, raising integrity concerns. When institutions deploy AI to reduce costs or increase efficiency without attending to how these systems affect human dignity and agency, benevolence trust erodes. Yet these outcomes are not inevitable. As institutional theorists emphasize, organizations retain agency in how they design and govern new technologies. Institutions can choose to deploy AI systems in ways that enhance rather than undermine transparency, fairness, and responsiveness. The critical question is whether organizations recognize trust building as a core objective of AI deployment rather than treating it as an afterthought. Organizational and individual consequences of institutional distrust. Organizational performance impacts. Institutional distrust imposes substantial costs on organizational performance across multiple domains. When stakeholders distrust institutions, they invest significant resources in monitoring, verification, and protection against institutional malfeasance. These transaction costs reduce economic efficiency and organizational effectiveness. In healthcare settings, patient distrust leads to delayed care seeking, poorer treatment adherence, and reduced participation in preventive health programs. Research on medical decision-making demonstrates that patients who distrust their healthcare providers are less likely to follow medication regimens, attend follow-up appointments, or adopt recommended lifestyle changes. When this distrust extends to healthcare institutions more broadly, hospitals, insurance systems, public health agencies, population health outcomes deteriorate. In governmental contexts, citizen distrust undermines policy effectiveness and increases enforcement costs. Citizens who distrust tax authorities engage in more tax evasion and tax avoidance, requiring governments to invest more heavily in compliance monitoring and enforcement. Citizens who distrust regulatory agencies resist compliance with safety regulations, environmental protections, and consumer safeguards. Citizens who distrust electoral institutions participate less in democratic processes or mobilize to obstruct institutional functioning. In corporate settings, consumer and employee distrust creates market inefficiencies and organizational dysfunction. Consumers who distrust corporations demand more extensive contracts, warranties, and third-party verification systems, raising transaction costs for all parties. Employees who distrust their employers reduce discretionary effort, hoard information, and invest in exit strategies rather than organizational improvement. Labor markets become less fluid as workers hesitate to trust new employers, and product markets become less innovative as consumers resist unfamiliar offerings. The introduction of AI systems can amplify these costs when deployment increases rather than reduces distrust. When institutions deploy algorithmic decision systems without adequate explanation or appeal mechanisms, affected parties invest more heavily in workarounds, gaming strategies, and resistance. When AI systems make errors that institutions fail to acknowledge or correct, distrust spreads beyond the specific system to the broader institution. When algorithmic systems treat stakeholders in ways they perceive as disrespectful or dehumanizing, relational costs compound operational challenges. Individual well-being and stakeholder impacts. Beyond organizational performance metrics, institutional distrust imposes direct costs on individual well-being and stakeholder welfare. Research on institutional trust and psychological well-being demonstrates significant associations between trust in major institutions and multiple dimensions of mental health, life satisfaction, and social functioning. Institutional distrust contributes to chronic stress and anxiety. When individuals cannot rely on institutions to function competently and fairly, they must invest cognitive and emotional resources in vigilance, contingency planning, and self-protection. This sustained activation of stress response systems contributes to psychological distress and may increase risk for depression and anxiety disorders. Distrust in specific institutional domains creates domain-specific harms. Healthcare distrust contributes to worse health outcomes through multiple pathways: delayed care seeking, poor treatment adherence, reduced preventive care, and avoidance of institutional healthcare settings. Financial institution distrust leaves individuals vulnerable to predatory lending, reduces participation in beneficial financial products, and increases economic insecurity. Educational institution distrust reduces educational attainment and perpetuates inequality across generations. The deployment of AI systems in institutions that already face trust deficits can compound these harms when implemented without careful attention to human impacts. Algorithmic systems that provide no meaningful explanation for adverse decisions leave affected individuals without recourse or understanding. AI systems that make errors but provide no clear path to appeal or correction impose costs on those who experience algorithmic mistakes. Automated systems that reduce human interaction and judgment may make institutional processes more efficient, but also more alienating and dehumanizing. Particular concern arises when AI systems affect already marginalized or vulnerable populations. Research on algorithmic bias demonstrates that AI systems trained on historical data often perform worse for demographic groups that were underrepresented or subjected to discriminatory treatment in training data. When institutions deploy such systems without adequate testing, validation, and bias mitigation, they risk exacerbating existing inequalities and further eroding trust among communities that already experience institutional marginalization. The psychological impacts extend beyond individual well-being to social cohesion and collective capacity. Institutional distrust reduces willingness to engage in collective action and cooperation with strangers. Ostrom, 1992, demonstrated that successful collective action depends critically on trust that others will follow rules and that institutions will enforce agreements fairly. When this trust erodes, communities lose capacity to solve shared problems, maintain public goods, and support vulnerable members. Evidence-based organizational responses. Transparent communication about AI systems. One of the most direct responses to trust deficits involves enhanced transparency about how institutions use AI systems, what these systems do, and how they can be challenged or corrected. Research on organizational justice demonstrates that procedural transparency, making decision-making processes visible and understandable, significantly enhances perceived fairness even when outcomes remain unchanged. Effective transparency about AI systems requires multiple forms of communication tailored to different stakeholder groups. Technical documentation matters for expert audiences who need to evaluate system validity and safety. But most stakeholders require different forms of explanation. Accessible descriptions of what the system does, what factors it considers, what it ignores, and how its recommendations or decisions get used in broader institutional processes. Key transparency approaches include plain language system descriptions, documenting in accessible language what AI systems do, what purposes they serve, what data they use, and what limitations they have. These descriptions should avoid both excessive technical jargon and misleading oversimplification, instead focusing on what stakeholders need to know to understand how systems affect them. Decision explanations. Providing individualized explanations when AI systems contribute to decisions affecting specific stakeholders. These explanations should identify which factors influence the outcome, what alternatives the system considered, and what stakeholders can do if they believe the decision reflects an error. Public AI registries. Maintaining publicly accessible inventories of AI systems in use, their purposes, their development and validation processes, and their performance metrics. This institutional-level transparency allows stakeholders to understand the scope and nature of algorithmic decision-making. Ongoing performance reporting. Regularly publishing information about how AI systems perform, what errors they make, how they affect different populations, and what interventions have been implemented to address problems. This temporal transparency demonstrates institutional commitment to continuous improvement. The City of Amsterdam maintains an algorithm register that documents AI and algorithmic systems used in municipal services. The register describes each system's purpose, legal basis, data sources, and impact assessments. While the specific details of implementation vary, the underlying principle, making algorithmic systems visible and understandable to affected publics, represents a core transparency intervention. Procedural justice in algorithmic decision-making. Beyond transparency, trust rebuilding requires attention to procedural justice, ensuring that decision-making processes, including those involving AI systems, satisfy widely shared fairness norms. Research on organizational justice identifies several procedural elements that enhance perceived fairness: voice, opportunity to be heard; neutrality, decisions based on objective criteria rather than bias; respect, dignified treatment; and trustworthiness, caring about stakeholder concerns. AI systems can threaten procedural justice when they remove human judgment from processes where stakeholders expect thoughtful consideration of their circumstances. Purely automated decision-making, with no opportunity for human review or appeal, may violate fundamental fairness norms even when technically accurate. Algorithmic processes that provide no mechanism for stakeholders to provide input or correct errors deny voice and reduce respect. Procedural justice interventions include human review of consequential decisions, ensuring that high-stakes decisions, those affecting liberty, access to critical services, or fundamental opportunities, involve meaningful human judgment rather than pure automation. This doesn't mean rejecting algorithmic input, but rather treating AI systems as decision support rather than decision replacement. Accessible appeal mechanisms, creating clear pathways for stakeholders to challenge algorithmic decisions they believe are erroneous or unfair. Appeals should receive genuine consideration from qualified reviewers with authority to override algorithmic outputs when appropriate. Stakeholder input in system design, involving affected communities in AI system development and validation rather than treating them merely as passive subjects of algorithmic processes. This participation enhances voice and increases likelihood that systems reflect genuine stakeholder needs rather than institutional convenience. Bias testing and mitigation, systematically evaluating AI systems for differential performance across demographic groups, and implementing technical and procedural interventions to address identified disparities. This neutrality work demonstrates institutional commitment to fair treatment. Explanation as core system feature, designing AI systems with explainability as a primary objective rather than an afterthought, recognizing that stakeholder understanding represents a critical component of procedural justice. Financial institutions implementing algorithmic credit decisions have faced significant regulatory pressure to provide applicants with meaningful explanations for adverse decisions. While implementation challenges remain substantial, many AI systems resist simple explanation. The underlying requirement reflects recognition that procedural justice matters for institutional trust and stakeholder protection. Capability building for institutional actors. Trust erosion partly reflects institutional incapacity. Organizations genuinely lack the skills, knowledge, and resources to deploy AI systems responsibly. Capability building interventions enhance organizational ability to implement AI in ways that strengthen rather than undermine trust. Many institutions adopt AI systems without adequate expertise to evaluate their validity, understand their limitations, or identify potential harms. This capability gap leads to preventable errors, undetected biases, and inappropriate applications of algorithmic tools. Organizations may purchase commercial AI products without sufficient technical knowledge to assess vendor claims or validate system performance. They may deploy AI in sensitive domains without understanding applicable legal and ethical constraints. Capability building approaches include internal technical expertise development, building organizational capacity to understand AI systems, evaluate their performance, and identify potential problems. This doesn't require every institutional actor to become a data scientist, but does require enough internal expertise to ask critical questions and assess external claims. Interdisciplinary AI governance teams, creating institutional structures that combine technical expertise with domain knowledge, ethical analysis, and stakeholder perspective. AI deployed in healthcare requires medical expertise. AI in criminal justice requires understanding of legal rights and procedural justice. AI in social services requires knowledge of vulnerable populations and program goals. Vendor accountability frameworks, developing procurement processes and contractual requirements that hold AI vendors accountable for system performance, bias mitigation, and explanation provision. Institutions that lack capacity to build custom AI systems still retain responsibility for systems they purchase and deploy. Continuous learning systems, establishing organizational processes for monitoring AI system performance, identifying problems, and implementing improvements. Trust depends not on perfect systems, which don't exist, but on institutional capacity to detect and correct errors. Ethical review processes. Creating institutional review mechanisms analogous to research ethics boards that evaluate proposed AI deployments for potential harms, fairness concerns, and trust implications before systems go live. Healthcare institutions implementing clinical decision support AI systems often establish clinical informatics teams that combine medical expertise with technical knowledge. These interdisciplinary teams can evaluate whether algorithmic recommendations make clinical sense, identify potential safety concerns, and ensure that AI tools enhance rather than undermine clinical judgment. Governance structures and accountability mechanisms. Institutional distrust reflects partly justified concerns that institutions lack adequate accountability for their decisions and actions. Strong governance structures and clear accountability mechanisms can rebuild trust by demonstrating that institutions subject themselves to meaningful oversight and face consequences for failures. Traditional governance structures often prove inadequate for AI-augmented institutions. Board oversight and executive accountability mechanisms designed for human decision-making may not extend effectively to algorithmic systems. Regulatory frameworks developed for earlier technologies may not capture AI-specific risks. Professional and ethical standards may lag technological change. Governance and accountability interventions include clear responsibility assignment, establishing who is accountable for AI system design, deployment, performance, and impact. Algorithmic opacity can obscure responsibility, with technical teams, management, vendors, and regulators each claiming limited control. Clear assignment prevents accountability gaps. Independent auditing. Engaging external parties to evaluate AI system performance, fairness, and safety. Internal assessment serves important functions but faces inevitable limitations. Independent audit provides credibility that purely internal review cannot match. Regulatory compliance frameworks. Developing organizational systems for ensuring AI deployments comply with applicable legal requirements, anti-discrimination laws, due process protections, privacy regulations, safety standards. Compliance demonstrates respect for legitimate external constraints. Impact assessment processes, requiring systematic evaluation of potential AI system effects before deployment, including impacts on different stakeholder groups, risks to institutional mission, and trust implications. These prospective assessments allow problems to be addressed before they materialize. Remediation protocols. Establishing clear processes for addressing identified AI system problems, how errors get corrected, how affected parties receive remedy, how systemic issues trigger broader intervention. These protocols demonstrate institutional commitment to accountability. DiMaggio and Powell, 1983, observe that organizations often adopt structures and practices because they confer legitimacy rather than purely because they improve efficiency. Governance mechanisms that may appear costly or cumbersome can rebuild trust by signaling institutional commitment to responsible AI deployment, even when their direct operational benefits remain uncertain. Psychological contract recalibration. The relationship between institutions and stakeholders rests partly on implicit psychological contracts, shared understandings about mutual obligations, expectations, and appropriate behavior. AI deployment can violate these contracts when institutions change how they operate without adequately renegotiating stakeholder expectations. Psychological contract violations trigger strong negative reactions, including distrust, reduced commitment, and active resistance. When institutions introduce AI systems that fundamentally alter how they interact with stakeholders, replacing human customer service with chatbots, substituting algorithmic screening for professional judgment, automating decisions previously made through deliberative processes, they risk violating implicit contracts even when technical performance improves. Approaches for psychological contract recalibration include stakeholder engagement before deployment. involving affected parties in conversations about AI system introduction, not merely informing them after implementation decisions have been made. This engagement allows institutions to understand what stakeholders value and where they have concerns. Explicit renegotiation of expectations. Clearly communicating how AI deployment will change institutional operations, what stakeholders can expect, and what new rights or protections will be implemented. This explicit discussion replaces violated implicit contracts with new shared understandings. Preserving valued human elements. Identifying which aspects of institutional operation stakeholders value specifically because they involve human judgment, empathy, or relationship, and ensuring AI deployment doesn't eliminate these elements without stakeholder consent. Creating new forms of agency. When AI systems reduce stakeholder control in some domains, offering enhanced control or choice in other domains. Psychological contracts incorporate reciprocity. Reducing stakeholder agency without compensation predictably triggers violation responses. Demonstrating continued respect. Ensuring that efficiency gains from AI deployment don't come at the cost of treating stakeholders as mere inputs to automated processes rather than as human beings deserving dignity and consideration. Healthcare institutions introducing AI diagnostic tools face psychological contract challenges when physicians worry that algorithmic decision support will undermine their professional judgment or when patients fear that technology will replace the therapeutic relationship. Successful implementations preserve what stakeholders value: physician autonomy, therapeutic alliance, while adding AI capabilities that enhance rather than replace human elements. Building long-term institutional resilience in an AI-augmented environment. Institutional identity and purpose clarity. Long-term trust rebuilding requires institutions to maintain clear identity and purpose even as technological capabilities evolve. Organizations that adopt AI systems without careful attention to institutional mission risk becoming vehicles for algorithmic optimization rather than purposeful collective actors. Selznick, 1949, argued that organizations develop distinctive competencies and value commitments that define their identity beyond merely technical functions. Institutions matter not only because they accomplish specific tasks, but because they embody shared values and serve collective purposes. When AI deployment seems to reflect primarily cost reduction or efficiency enhancement rather than mission advancement, stakeholders question whether institutions remain faithful to their defining purposes. Purpose clarity requires institutions to articulate how AI systems serve their fundamental missions rather than distract from them. Healthcare institutions exist to promote patient health and well-being, not primarily to optimize billing or reduce length of stay. Educational institutions serve learning and human development, not just credential production or ranking maximization. Government agencies advance public purposes defined by democratic processes, not merely bureaucratic efficiency. AI systems designed with mission clarity can enhance institutional capacity to fulfill core purposes. Algorithmic tools that improve diagnostic accuracy serve healthcare missions. AI that personalizes learning pathways serves educational purposes. Automated services that improve accessibility advance democratic governance. But AI systems that increase efficiency at the expense of core values. Treating patients as diagnostic puzzles, students as metrics, or citizens as administrative burdens betray institutional purpose. Organizations building long-term trust must regularly assess whether AI deployments strengthen or weaken institutional identity. Do these systems enhance capacity to serve core missions? Do they embody institutional values or contradict them? Do stakeholders perceive AI deployment as faithful to institutional purposes or as mission drift? Honest engagement with these questions requires institutional leaders to maintain clear purpose even amid technological change. Distributed governance and stakeholder voice. Long-term institutional legitimacy depends partly on governance structures that incorporate diverse perspectives and provide meaningful voice to affected stakeholders. Centralized, Technocratic decision-making about AI systems, even when well-intentioned, risks producing systems that serve institutional convenience rather than stakeholder needs. Ostrom, 1992, demonstrated that successful governance of common pool resources depends critically on stakeholder participation in rulemaking and monitoring. When affected parties help design institutional rules, compliance increases and legitimacy strengthens. Similar principles apply to AI governance. When stakeholders participate meaningfully in decisions about whether, how, and where to deploy algorithmic systems, they develop ownership over institutional choices rather than experiencing them as external impositions. Distributed governance doesn't mean pure democracy in which all stakeholders vote on every technical decision. Effective participation requires appropriate structures that combine technical expertise with stakeholder perspective, enabling informed decision-making while providing genuine voice to affected parties. Meaningful stakeholder voice in AI governance includes several elements. Representation on governance bodies, including stakeholder representatives on committees and boards that make decisions about AI adoption, development, and oversight. Consultation processes, creating structured mechanisms for gathering stakeholder input on proposed AI deployments, system designs, and policy choices. Community review, engaging affected communities in evaluation of AI system impacts, particularly for populations that may experience differential effects. Appeal and complaint mechanisms, providing accessible channels for stakeholders to raise concerns about AI system operation and ensuring these concerns receive serious consideration. Organizations building long-term trust recognize that initial stakeholder resistance to AI deployment often reflects legitimate concerns rather than mere technophobia. Engagement with these concerns can improve system design, prevent harmful applications, and build shared ownership over technological choices. Continuous learning and adaptive governance. Trust in AI-augmented institutions requires organizational capacity for continuous learning and adaptation. AI systems are not static artifacts that, once deployed, function unchangingly. They evolve through retraining, drift as data distributions change, interact with altered human behaviors, and face novel situations their developers never anticipated. Institutional governance must adapt accordingly. Organizations that treat AI deployment as a one-time implementation decision rather than an ongoing governance challenge predictably encounter problems. Systems that performed well initially may degrade. Applications that seemed beneficial may reveal unexpected harms. Technical fixes that solve immediate problems may create downstream complications. Continuous learning involves several organizational capacities. Performance monitoring, systematically tracking how AI systems perform over time, not just at initial deployment, but continuously as contexts change. Error detection and correction, establishing processes for identifying when systems make mistakes, understanding why errors occurred, and implementing corrections. Impact assessment, regularly evaluating how AI systems affect different stakeholder groups, watching for differential impacts that may not have been apparent initially. Environmental scanning, attending to how external contexts change in ways that may require institutional adaptation. New regulations, shifting stakeholder expectations, emerging technical capabilities. Organizational learning, creating structures that enable lessons from specific AI deployments to inform broader institutional practice rather than remaining siloed knowledge. Gibson, 1979, introduced the concept of affordances, possibilities for action that environments provide to organisms. AI systems create new affordances for institutional action, but these possibilities change as technologies, contexts, and stakeholder expectations evolve. Institutions that maintain learning capacity can recognize and respond to shifting affordances rather than becoming locked into obsolete practices. Organizations building long-term institutional resilience recognize that the relationship between AI deployment and institutional trust is dynamic rather than static. Today's trust-building transparency practice may become tomorrow's compliance ritual that stakeholders view cynically. Yesterday's cutting-edge fairness intervention may prove inadequate for emerging challenges. Continuous learning allows institutions to adapt their governance practices as technologies and contexts evolve. Conclusion: institutional trust erosion represents one of the defining challenges for contemporary democratic societies. When citizens, patients, consumers, and other stakeholders lose confidence in the institutions that structure economic, political, and social life, both organizational performance and individual well-being suffer. The integration of AI systems into institutional operations introduces new complexities to this trust landscape, creating risks of further erosion when handled poorly, but also potential opportunities for trust rebuilding when approached thoughtfully. This article has examined evidence-based organizational responses to institutional distrust in the age of AI. Key interventions include transparent communication about algorithmic systems, procedural justice in AI-mediated decision-making, capability building for responsible AI deployment, strong governance and accountability mechanisms, and psychological contract recalibration that preserves valued elements of institutional relationships while adapting to technological change. Several themes emerge across these interventions. First, trust rebuilding requires treating AI deployment as fundamentally an institutional and relational challenge, rather than merely a technical one. Organizations that focus exclusively on algorithmic performance while neglecting stakeholder experience predictably encounter resistance and distrust. Second, transparency and procedural justice matter enormously, often independent of objective outcome quality. Stakeholders care not only what decisions institutions make, but how they make them, whether processes seem fair, and whether affected parties receive dignity and respect. Third, one-size-fits-all approaches prove inadequate. Different institutional contexts, stakeholder populations, and application domains require tailored interventions that respond to specific trust challenges rather than generic best practices. Fourth, trust rebuilding is a long-term institutional commitment rather than a discrete project. Quick fixes and superficial transparency gestures may provide temporary legitimacy, but cannot substitute for sustained organizational change. Institutions serious about trust must invest in capability building, governance structures, stakeholder engagement, and continuous learning, costly commitments that pay dividends over time rather than immediately. Finally, the relationship between AI deployment and institutional trust is not deterministic. Organizations retain agency in how they design, deploy, and govern algorithmic systems. Institutions can choose to implement AI in ways that enhance transparency, strengthen procedural justice, preserve human dignity, and demonstrate respect for stakeholder concerns. These choices require explicit attention to trust implications rather than treating trust as an afterthought. As AI capabilities continue to advance and institutions increasingly integrate algorithmic systems into their operations, the challenge of maintaining institutional legitimacy will only intensify. Organizations that recognize trust as a strategic priority, that invest in transparent communication, procedural justice, stakeholder engagement, and adaptive governance, position themselves to navigate this transition successfully. Those that treat trust as a constraint to be managed rather than a relationship to be nurtured face continued erosion and potential institutional failure. The path forward requires institutional leaders to ask difficult questions. Do our AI systems serve our fundamental missions or distract from them? Do they enhance or undermine our capacity for fair treatment of stakeholders? Do they demonstrate respect for human dignity or reduce people to data points? Do they strengthen or weaken the psychological contracts on which institutional relationships depend? Honest engagement with these questions and genuine commitment to trust-building responses represents the foundation for institutional resilience in an AI-augmented future.